Hi, my name is McKinley Brisbane, and this is my presentation about asthma for Nursing 112. Today, I will be discussing the etiology of asthma, nursing diagnoses related to it, diagnostic tests, medications and treatment, and health teaching. Asthma is one of the most common respiratory disorders in Canada. About 10% of the population currently have asthma. Asthma is a chronic inflammatory disease of the airways characterized by airway hyperresponsiveness or an increased airway narrowing reaction to certain triggers like viruses, allergens, and exercise. It is linked to chronic inflammation and causes recurring episodes of wheezing, dyspnea, chest tightness, and coughing that can change over time and in intensity. The etiology of asthma consists of asthma triggers that are classified as allergic, non-allergic, genetic predisposition, and childhood factors. Allergic triggers for asthma can include dust mites, grass, flowers, animal dander, mold, spores, and pollen. Non-allergic triggers would consist of exposure to cigarette smoke, cold air, exercise, and viral infections. Childhood risk factors can include maternal smoking, allergic sensitization, antibiotic use and infections, and decreased lung function as a child. Some common symptoms of asthma include wheezing, breathlessness, chest tightness, cough, and dyspnea. During severe asthma attacks, the use of accessory muscles, diaphoresis, and distant breath sounds are all present. One of the primary tests that is done in order to diagnose asthma is pulmonary function tests, which consists of spirometry, bronchial trigger test, and lung diffusion testing. Spirometry is especially helpful in diagnosing asthma or COPD. It is because it tests how much air you can exhale from your lungs after taking in a big breath and how fast you can blow all of that air out. For this test, you would sit upright in front of the machine attached to a plastic mouthpiece. It's important that the mouthpiece fits snugly so that all the air you breathe goes into the machine. Some indicators from the pulmonary function tests that would indicate that you do have asthma would be an increase of 12% or more in the forced expiration volume after a short-acting bronchial dilator is administered. This means that if you had a 12% increase in how much air you can blow out after you've administered a short-acting bronchial dilator, then that could mean that you have asthma. Bronchial trigger tests can also help to identify potential triggers, such as being exposed to smoke, perfume, or scents, pollen, grass, or dust mites, for example. These can also help to classify the severity based on the ratio of forced expiratory volume to forced vital capacity, which means how much air you can push out versus how much air is within your lungs. Some lab values or tests that may be administered in order to diagnose asthma could include oxygen saturation, which means the percentage of oxygen that's within your blood. The normal range is about 100 to 95. So oxygen saturation of 92 to 97 could constitute moderate asthma, and less than 92 would signify severe asthma. We can also look at arterial blood gases. If someone is in respiratory alkalosis, this could also indicate that they may have asthma. Another important lab or test to do is allergy testing. When allergy testing is done, they are usually looking for the IgE for inhalant allergens to see if those are the ones that are calming their asthma symptoms. Some of the sources they may be looking for are animal dander, indoor mold, grass, flowers, or even cockroaches. Here are 4 nursing diagnoses for asthma. Ineffective airway clearance. This can be shown by the following signs and symptoms: abnormal breath sounds, abnormal respiratory rate, rhythm, and depth, dyspnea, excessive secretions, hypoxia or cyanosis, inability to remove airway secretions, ineffective or absent cough, and orthopnea. The interventions we would implement are to maintain adequate patent airway, to mobilize secretions, to assess changes and note complications, and to promote wellness. Some examples of nursing interventions could include teaching the patient the proper ways of coughing and breathing, educate the patient on optimal positioning, making sure they're sitting up or using the tripod method if they're having difficulty breathing, assess their hydration status, their skin turgor, mucous membranes, and tongue, assess for abdominal or thoracic pain, review the patient's understanding of their own disease process, which in this case would be asthma. Part of the promoting wellness and teaching discharge would be making sure that our patient knows how to use their medication properly and adhere to a proper treatment plan. Impaired gas exchange. The outcome we want is to demonstrate improved ventilation and adequate oxygenation of tissues by arterial blood gases within baseline parameters and absence of symptoms of respiratory distress. The interventions that we would implement would be assess contributing factors, evaluate degree of compromise, improve existing deficiencies, and promote wellness. During assessment, we would look at their allergic reaction, decreased lung compliance, infection, and anything related to ineffective breathing pattern. We would note their breathing pattern, rate depth if they were using accessory muscles, pursed lip breathing, cyanosis, their perception of ease of breathing, if they were restlessness, we would listen and auscultate their breath sounds. We would note the character and effectiveness of the cough mechanism in clearing their airways of secretions, and we would assess their level of consciousness. A couple more interventions would include elevating the head of the bed and position the client appropriately, provide suction to clear or maintain their airway if appropriate, encourage deep breathing, changing their positions, and coughing exercises. Part of the promoting wellness for teaching and discharge would be to review their risk factors for preventing and managing their symptoms of asthma, discuss allergy testing if needed, review their meds, and make sure that they will adhere to the administration of them. Administering these meds would include inhalers, bronchodilators, and vasodilators. Another important step is to encourage them to keep their environment allergen and pollutant-free once they are home. Ineffective breathing pattern. Our outcome is to establish an effective breathing pattern with the absence of cyanosis and other signs and symptoms of hypoxia. The interventions would be similar to the past two I've discussed. Identify etiology or what factors are causing this, provide relief for these causing effects, and promote wellness, which includes teaching and discharge considerations. We would evaluate their respiratory status, rate, depth, and rhythm of respirations, observe their breathing pattern. Are they using accessory muscles, nasal flaring, apnea? Are they breathing with their pursed lips? We would also do a physical assessment, see if there's a cough present, and note their skin color. We would promote treatment with meds and therapy, oxygen if needed, deep breathing is encouraged, and make sure to maintain a calm approach. We want to encourage self-evaluation and knowledge of their meds before letting them go home, promote symptom management, home treatment adherence, and avoidance of known triggers. The final nursing diagnosis I want to talk about today is anxiety. We want people to be able to verbalize their awareness of feelings of anxiety, appear relaxed, and report that their anxiety is manageable, and use their resources and support systems appropriately. Anxiety with asthma can be related to their change in environment, change in health status, their loss of control, hypoxia, and respiratory distress. We would see people have apprehensiveness, have frequent requests for someone to be in the room, be restless, have tachycardia, breathing fast. The interventions that we would implement would be to assess their level of anxiety, to assist the client with identifying feelings and beginning to deal with the problems that are related to their anxiety, provide measures to comfort and aid the client to handle their problematic situation. We would also want to monitor their oxygen saturation, as increased anxiety can be an early sign of hypoxia. One more thing with anxiety and asthma is a large part of it can be providing use of relaxation techniques. Stay with the client and encourage slow, deep breathing, especially when someone feels like they cannot breathe. On this slide, I have outlined the 4 main aspects of treatment for asthma. Medication. This includes inhaled corticosteroids, combination inhalers, which are long-term. They're taken daily to keep asthma under control. Rescue medication or rescue inhalers. These are used for rapid symptom relief during an asthma attack. These would be short-acting beta agonists. Allergy medications or immunotherapy can be appropriate as well. Patient education would include teaching patients how to use their inhalers appropriately and adhere to treatment plans to keep their asthma under control. An example of this would be telling patients to make sure to rinse their mouth out after they take a steroid medication to reduce the chances of them developing thrush. Patient education also includes helping with the patient figure out their triggers to avoid and reduce the severity of their symptoms. Part of lifestyle changes includes preventing mole spores, using your air conditioner, reducing pet dander, cleaning regularly, decontaminating your decor, cover your mouth and nose if cold air is present outside, avoid triggers to smoke or other pollutants, and control your heartburn or GERD if this is contributing to your symptoms. The last section is the asthma action attack. This can include making a list of triggers and steps to avoid them, increasing or decreasing your meds based on your use and symptoms, track your symptoms to see if this treatment is working, and talk to your GP to see if the changes need to happen. The 4 major things I would tell a patient with asthma during my health teaching would be to follow your asthma attack, get vaccinated against influenza and pneumonia, learn to identify and avoid your asthma triggers, and take your medication as prescribed. Asthma can be fatal if not properly treated proactively or during an asthma attack. It's important to seek medical treatment if someone is straining to breathe, turning gray or blue, if they have no relief from the rescue inhaler, or presents with an altered level of consciousness. Asthma can be controlled by avoiding allergen triggers, using appropriate medication interventions, and adhering to proper treatment of your asthma, unlike in this video from the show House, where she's showing how she uses her inhaler. Thank you for listening to my presentation regarding asthma.